Hey everyone, I'm Charles Stevens, the founder and executive director of the Counter Narrative Project. And I'm here today speaking with Max Boykin. Max, would you like to say who you are and what you do?
Hey, y'all, I'm Max Boykin with the Black AIDS Institute. I'm helping build out our policy advocacy department, and I love to talk about healthcare.
So today we're here to talk about not just healthcare access, but really how to engage, particularly Black communities around fighting for healthcare access, really reimagining healthcare advocacy to integrate a more racial justice lens, and just share some of our experiences about how we've been engaged in working our communities around healthcare access.
Definitely.
So, what do you want to start? Well, actually, I have a question. Okay.
Go ahead.
So, my take has been, and certainly, in the comments, if you disagree, let me know. But I think I've been really disappointed with a lot of the healthcare advocacy that I've seen, because I feel like I haven't really seen Black folks be very central, particularly in the HIV community, very central in a lot of fights, a lot of the analysis, and a lot of the considerations around healthcare access. What are your thoughts about that, Max?
Yeah, so the simple answer is it's complicated, right? And then the longer answer is very, very complicated, right?
Okay.
The Affordable Care Act, as it was definitely a step in the right direction, but marred in a lot of problems and that weren't actually institutional of the actual bill itself, but actually more connected to the way in which politics works out in this country.
Yeah.
And a lot of the problems was, the Affordable Care Act itself is an extremely complicated bill. And when we talk about healthcare, we're not really, the Affordable Care Act does miss people, especially in southern states where you don't have Medicaid expansion. Those folks never got to see what the ACA can do.
Well, let me back up a little bit.
Yeah.
So if we are to the current political landscape for Black struggle, right, in this country, the current political landscape for Black movement, right, where do you think the fight for healthcare access fits in that?
So it's a very interesting one, right? For Black folks, there's so many other things that are on our list of things before we actually get to healthcare, but we do know that impacts us every day.
And we're in terms of healthcare disparities, we're usually at the bottom of most.
And we do see that. We got, I can talk about, we got strokes, high blood pressure, HIV, breast cancer, all these different things disproportionately impact Black folks.
Impact our
but
community.
Because of there are so many other things that are impacting us, right? People don't have access to jobs. People don't have access to good education. And because they have made this healthcare thing so, in many ways, abstract and complicated, folks can't even get into that. They're just like, yo, that's something over there. I ain't never going to have a chance to get into that. And also a history of the way in which the medical system within this country, it hurts Black people.
History and present, right?
Right. There's many different ways in which, from the Tuskegee Institute to the way in which slaves were disproportionately impacted, and how in which we were studied on to find new ways, and then given no credit. Nothing was given to us, and nothing was actually ever named after us, but it was many times our cells that were used in order to define all these amazing things, such as stem cells. That is something that we have to reconcile with, right? I actually think America needs to reconcile that with Black folks. So that's a piece of it. When we understand how in which healthcare works. But we do have some folks that have been on the front line that are definitely Black, and specifically Black gay men, of talking about healthcare and talking about how in which we do it. But I think one of the biggest things that we have to do is simplify that message, talk about why it's important to folks, but also upping what I would consider a political analysis of healthcare with an actual understanding of health literacy. What does all this mean when we're going to the doctor and they're spewing out all these things to us? What can we actually do about it?
And I also think that, what you're saying about simplification, I would just say I think political education is just really important, so that it's just not academics and policy wonks that are really in charge of shaping the narrative around healthcare advocacy, but really having grassroots organizers, people that are committed to anti-prison industrial complex work, or folks working around economic justice, like really trying to build power with those movements, so that we're able to better connect the dots in terms of the various issues that are impacting our community. But even in terms of the messaging, like I know looking at the fight around the Affordable Care Act, for example. And I think that work was certainly amazing and inspiring and powerful. Again, I just noticed that from my perspective, I just didn't feel like they were really engaging Black communities very much. Specifically, I mean, certainly when it was time to sort of enroll in the Affordable Care Act, I think Black communities were engaged. But just in terms of like when we think about healthcare advocacy, when we think about the kinds of policies that we want to see happen nationally around healthcare, I'm just not sure if the voices of Black folks are really very central in those conversations. And I could be wrong, but that's just what I.
From my work with the Protect Our Care Coalition, which is a great coalition, I actually think has done great work in amplifying great things that the Affordable Care Act was able to do. Right, it cut the uninsured rate for Black people in half, which is a great thing. But it could have been so much more, and still Black people's uninsured rates are still higher than Latinx folks and white folks within this country. Right?
Why do you think that is?
One, Medicaid expansion wasn't expanded in many of the states of the South, which have some of the largest Black populations. Other people not really understanding it, right? And people being put within that gap, right? Just because you make a certain amount don't mean, and when we're taking care of like many times large numbers of people within our family, trying to make sure that happens, right? It can hurt us within our ability. I remember signing people up for health insurance. One of the big reasons I came to Chicago was to help people figure that out. And even for myself, trained in it, being able like, this is a very complicated thing for a family to try to come in and understand, right?
Absolutely.
So that is why in which I think our messaging has to be simpler. It has to be more all encompassing, right? It can't be like leaving some of us out. That is one of the biggest problems I think that folks have with trying to advocate for it. And it leaves too many of us out, and we have to bring our folks in when we talk about healthcare, right? We have to say like, okay, this is important to us. This is why it's important to us. These are the things. And also my problem in essence with some of the messaging in the last year and a half was it was focused on getting these white Republicans to change their minds and care about people that they never cared about, right? If they don't care about these communities in the first place, they ain't gonna care about it. So it is really, to me, is about building the power within our communities and understanding with that political education, that health literacy, tying those two in together and saying like, this is what we really wanted in the first place, right? I think the great thing about Obamacare was it gave us a new essence like, oh, it is possible for more of us to get health insurance. But what it didn't actually do is say like, oh, there's a next step to that, right? Right now we have a very multi-pronged health insurance system, right? It's called our healthcare system is multi-payer. Right, where you have people that have private insurance, people that got insurance through their job, some people pay into a one, say you're starting your own business, right? One of the big reasons people, take jobs that they don't want is because they're like, hey, I need to have some benefits, right?
Especially the families.
And it's like, I got kids, trying to get kids on your health insurance is a whole nother problem for folks, right? And then like, how many dependents do you have? All these different things. Instead of what some countries already have within in the Western world, a single payer system, right? Where everyone pays into it and everyone gets access to health.
I was going to ask you if you could talk a bit about, I know you co-authored this op-ed on single payer, and I was wondering if we talk a little bit about what your arguments were in that op-ed that you co-authored.
So I co-authored the op-ed with Serge Maduri, who works with TAG, and it was really a great chance to talk about why didn't we just say like we wanted healthcare for all? Like we were talking about, we want to keep this ACA, but there's a message past that, right? And there's definitely some short-term goals. We want to make sure that people are getting health insurance because we don't people want to die without it. One of the big reasons I do this work is because I lost my aunt and uncle because they didn't have access to these things. But what I do want is for in a state where they lived, in the state of Alabama, where they still would not have access to these things, I need more, right? And I need people to have complete access to it. So our argument really was everyone should have access to health insurance. And it is a human right. And it is actually something that people do want, right? People do want to have access to health insurance. They want to be able to go to the doctor, go in there, get what they need, right? And be preventative in many ways, get the help from their doctor and come out and not have a $500,000-some bill coming out when they get out of it, right? And there's two pieces that I really think are important when we think about the HIV community actually being important in this. One, we actually have something that is similarly kind of in place around that, right? With the Ryan White Care Act, there was really many places like no matter what you are, as long as you're HIV positive, you can get these services, right? And that is a way in which, why? And it was just a radical thought that no matter who you are, you can get these services. No matter your immigration status, no matter where you live, we want to make sure that you get some kind of help through this, and making sure that it's holistic. They're adding within how in which we got HOPWA, and includes housing. We have different things to make sure that folks can get incentives for dental work that they need. All these different things. All right, it's definitely not perfect, and it's also subsequent by our Medicaid system, which is the other piece, right? So we have Ron White Care Act topped with Medicaid. Which actually helps people. And two of the most things I actually like, a lot of folks that are on Medicaid and do enjoy it because they're like, hey, I'm not paying this ridiculous copay. I have health insurance. I can go to my doctor. I can get these things. That's great, right? And we want to actually make sure that folks continuously to get that.
Absolutely.
And then on top of that, making sure the other thing is health insurance can be very complicated, especially when you get in private markets. There's different plans, and even the marketplace with the Affordable Care Act, it's more complicated. People aren't sure what's all in it. There's a lot of research that you got to do. I want to be able to go say, I need this help. This is what I have. And consider that, we're not allowed to discriminate people for pre-existing conditions, which included HIV for many, and how in which, some people were excluded. And they had to go outside the system to get the help that they needed, especially in the early parts of the epidemic. And when we think about that, we got to think about, we don't want people to have to do that. Why don't we make sure that we're getting the best system, and we're not paying as much? Because the United States pays more for healthcare than anybody else. But one of the most loved things is Medicaid, because the cost-benefit analysis actually you don't spend as much and you get better care out of it.
Well, that was really powerful, Max. Thank you so much for sharing that with our listeners. And definitely make sure that you like the Counter Narrative on Facebook and stay tuned for some of our other Facebook Lives. Thank you. All right, thank you.